Thank you, Mary. Thank you, Mary, and thank you, Eden, for allowing me to be the speaker. Um, I am Debbie Thomas, and I am the Chief Executive Officer for the Walker Center. We're celebrating 50 years of providing services in Idaho, and we specialize in addiction treatment and the co-occurring mental health situations that occur in all of us, but especially in people that have substance use disorder. I am a licensed professional counselor. I'm an internationally certified alcohol and drug counselor, and I have a master's in addiction counseling. Um, I don't say those things to brag. I say those things because when I go to a presentation, I want to know, like, why do you have any credibility to teach me something? So to me, the letters say something about I have some book knowledge and I pass some tests. But the real part that I want to share with you is that my passion is helping people um, become resilient, become the best version of themselves. And those of us that chose to join the helping profession, we need our own resiliency so that we can give away and help people. Um, I started my career literally more than 40 years ago. And I've had the honor of doing a variety of things. I have worked with adolescents and families. I have worked with women coming out of prison. I've worked a lot of addiction programs. But most recently, my passion is supervising people, building systems of care that help with bringing workforce in at all levels. And so I'm really honored to bring you some skills and have the opportunity to learn from you as well. So with that being said, feel free to use the chat. I know Mary's going to help me watch it. I won't necessarily see all the comments, but I give Mary permission to interrupt and be like, hey, there's a great question in here. So we'll get started. Um, Ooh, first thing is it's not going to advance. Here we go. It's going to now. So a little bit about the Walker Center and more because it helps you understand the passion. The Walker Center started out doing residential addiction treatment in 76. But what we learned is that we needed to build a full continuum of care. And the first thing that we did was we connected with lots of people across the state of Idaho, and they started building outpatients, and we learned about mental health care that people could do and which doctor was able to help people, which local communities had crisis centers. And big things that always came up in those themes was not enough safe housing, not enough connection with community because mental health and addiction have such stigma associated with them. So one of the things that I passionately did was expanded our outpatient services and realized that we as a continuum of care had to build sober living. So our outpatient, we added English and Spanish speaking. We have translators that in my particular region of Twin Falls, we have three different populations of refugees that have come in, and there's a lot of trauma and addiction and mental health that goes with that. And in our sober living house, I decided that we would have live-in recovery people. We would also have employees that had gone through their own specialized training. So everybody went through recovery coach training. And I thought, well, I can't just bring my understanding of addiction and the book knowledge from a master's level clinician. And I can't just bring my administrative part, and I can't bring the fact that I worked the 12 steps for my own food addiction. I needed to find out what was out there evidence-based. So I did a lot of reading about peer support. I was a huge advocate for us bringing recovery coaching to the state of Idaho. And so I went and became a recovery coach. And people are like, why are you doing that? That's like a lesser credential. And I'm like, no, you can't teach, coach, supervise if you don't know what the real issues are in the field. So I've done recovery coaching, and I try and stay current on what the real barriers are to you all being successful. Um, so hopefully what I'm going to present to you now over the next hour and 45 minutes doesn't sound like Charlie Brown going wah, 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 but it sounds like something that you might be interested in leaning into, and you could take away a few nuggets. Um, So we're going to talk about why peer support and recovery coaching is important. And you guys could probably write dissertations on that. We're really going to define why we need to clearly define the role that brings professionalism to the role of a peer. We're going to identify the common pitfalls and a little bit of ethical boundary setting issues. We're going to learn the importance of promoting that recovery and how we remove barriers and encourage hope. We're going to identify the tools for teaching resiliency to the people that you are doing support with. And in doing that, I hope that you take away some skills that you can apply to yourself. Because if we aren't doing these resiliency things, we're not going to be successful long term in the field. And my passion is I don't want any of us as professionals to be on the quick burn, and organizations can really burn out passionate people quickly by undertraining, underskilled, not supporting them. Or if you manage to stay in the field for decades, you could become what I call the crispy critter, who is burnt out, stressed out, codependent, angry, frustrated, and really not helping anyone. So my takeaway is let's use these skills on ourselves while we're also learning them to use with the people that we're helping. And then we're really going to state ways that we can reinforce that positive change and celebrate the milestones. We as a society spend a lot of time judging each other, sharing why things aren't working and what you should and must do differently, instead of really celebrating the successes and the small steps that get us to really big, amazing things. And I'm a little bit on a professional and connection high emotionally. I hosted an alumni event at the Walker Center, and we had alumni from all over. You know, somebody came as far as Michigan to come back to where they started their recovery, and we had 296 and a half years of sobriety in the room. And you talk about like infusing hopefulness and that change is possible. It was just right there. So I hope in your resiliency to stay in your role, that you develop times that you are exposed to people that have done the really tough work. Because in the short run, we oftentimes don't see how our work is impacting people. And then by the time our little seeds have grown, they're on to bigger and better things. And you don't always get to see what change you helped influence. So that's a lot to accomplish in the next hour and 40 minutes or so. So why are peers important and what do peers do? Peers are important because they're the connectors, and you're not a master's level clinician necessarily. You're not doing the work in a confined environment. You are doing this out in the real world. You also, the purpose is to encourage that hope that change can't happen if people don't think that there's the opportunity for change. And again, the world, society, families, the person themselves has done so much self-degradation on why they're messed up, a failure. I'm never going to be fill in the blank, never going to be good enough. And so for us to help peers change, we really have to encourage that hope is possible. Having one or two good stories that are real and honest that you can share of how you've seen your impact help somebody change will really give people a positive opportunity instead of a false sense of, yeah, you're just telling me that, but I'm not able to change. So that optimism is there. And the other part that a peer support person or recovery coach is really focused on is how can you help a person in healthy living in all the different dimensions of their life, be the best version of themselves with all the things that are dealt, because we are all dealt something. Some people have mental health, some have physical health, some have trauma, but we all are dealt something. And the important part of a peer is that you've had your life journey as well. And with health and boundary, you could share that with others.
You're welcome.
Does anybody have something they were going to say? Maybe not. So peer support, recovery coaching, I'm going to use those terms interchangeably throughout this presentation, what I want you to know is that you are a crucial role in the treatment continuum and that you're vital, that nobody is in a hierarchy where the doctor with their degree is more important than the nurse, or the nurse is more important than the master's level clinician, or that person's better than the recovery coach. It is all of us leveraging our individual experiences to help people navigate the challenges of wellness, sobriety, the accesses to treatment options, navigating this very complicated system of help. And if anybody's been in the system of help for longer than a minute, you know how complex it is. And then particularly if you put people in that have more than one issue, if you've got substance use and mental health and physical health, all of those things magnify, and not by a little bit, but it's a synergistic effect. So here's the key factors that I really want you to think about as you realize your role and what you're trying to do. So the first thing you're trying to do is do motivational support for people. That is, how do you get them to stay engaged? How do you help them set their realistic, individual, achievable goals and creating that in a positive, reinforcing way, celebrating the milestones? Because everybody else in their world is going to tell them, as well as their own brain, all the little things they didn't do right. So your big goal always is, how do you get them to see the advancements that they're making, not the failures? The other part is offering connections and relatable opportunities that can foster how people can learn to trust and be open in their communication. Because as we all know, we're only as sick as our secrets. If you don't bring a struggle out into the light, you're not going to be able to be vulnerable enough to ask for the assistance for that particular thing. So one of the things that's wonderful about having peers working with people is that peer has already had the opportunity to bring out their struggles into the daylight, and they understand the importance of the journey, and it gives that opportunity for that motivation and connection to start in a really safe environment while you're helping work yourself out of a job, where you're helping them connect to their spiritual growth, their employment opportunities, their 12-step or their smart recovery, or their anything kind of connections. The other part that a lot of times organizations start with is how anybody with peer supports offer practical assistance. And that is all the daily challenges, like, do you know how to find housing? And do you know how to help them fill out Medicaid paperwork? And do you know how to help a person navigate finances and where the resources in their community are for food boxes and. That alone is a full-time job to keep up with all the resources that are available or are complicated to find or easy to find, but nobody knows about them. And so coming alongside that person, instead of saying, the role of like a clinician is like, oh yeah, go out and do X, and then come back to me next week and tell me how that all worked out for you. As a peer, we get the opportunities to come alongside that person and do things with them, and have multiple meetings if you need to, and go with them to a particular community resource. The other part that's important and vital in the peer role is the education about information as a whole. You're educating about medications, whether that's a mental health medication or medication-assisted therapy for substance use. You're not the doctor, you're not prescribing, you're not telling them the doses better, worse, should be more, should be less. You're just giving them the facts and helping them understand the facts, helping them coordinate good questions to ask their prescriber. You're helping educate people on coping mechanisms. You also are helping people with that family engagement, facilitating communication and tough conversations with loved ones, friends of choice, people of birth, all of that kind of stuff. And you have to do that all with an understanding of how there are negative stereotypes about people with mental illness. There are negative stereotypes about people with addiction. There's negative stereotypes about people that have had a child custody case or a criminal charge. And oftentimes that's the peer themselves who's had to navigate that. And so the peer ends up having stigma associated with your role while you're trying to help people that have stigma associated with their challenges. Um, so after sharing that with you, I just want to have everybody raise their hand, pat themselves on the back, give a big cheer that you chose to be vulnerable, to become competent, and dive into a very challenging role that can be very meaningful and rewarding, because there aren't a lot of people that would be willing to do this, and there's not as many people as I would like to have happen and do this role. So in the reverse, the benefits of using peers, anytime a provider can get a peer involved, we know the outcomes. There are higher retention rates into treatment, and there are increased supports. There's increased accountabilities for that person. If I, as a doctor, or if I, as a mental health therapist, can do a warm handoff, then you know that you trust that peer and they're going to help the person navigate the system that you don't have the opportunity to do. We know that the relapse rates on readmissions to hospitals, return to use, all improve. We know that people that have connected with peers have a better ability to manage their triggers, and an overall quality of life that is improved in every dimension. Has improved when we see that there's peers involved in someone's life. And many of you know peers are integrated into all different types of work. We have outpatient programs that regularly identify peers and say you're going to meet with your peer once or twice a week, and you're going to see your doctor, and you're going to see your counselor, you're going to go to this group. We have medication assisted therapy opportunities where people work in a prescriber's office and are helping with MAT services on the substance use side. We have emergency departments and our health and welfare that have people assigned as peer supports to provide a part of a therapeutic team to reduce hospitalizations. So there's lots of community-based opportunities for people to be involved. And I think Idaho is, making strides, and, you guys are all going to be able to go out and advocate and role model of why this is helpful for our system of care. So many times people say, well, there's differences in peer support and treatment. And I don't think there is. How people use their evidence-based practice is different, but both treatment and peer supports want people to stay in treatment, relapse less. And that doesn't mean whether it's physical health. We don't want your blood pressure and your diabetes to get out of control. We don't want you to return to the state hospital because you were off of your bipolar medicines. We don't want you to end up back in jail because you returned to use for your substances. Overall, the approach is everybody wants an improved quality of life. So don't allow the stigma to tell you that you're not valuable in the system of care. But there is a lot of stigma associated with our role. So one of the first resiliency things for yourself as a provider and for the peer that is receiving the care is we have a responsibility as peer supports and recovery coaches to make sure that we're properly trained. And Empower Idaho and the fact that you guys are here shows that you are undergoing specialized training. You're trying to become able to effectively support individuals, and you're learning to address a complex group of issues that come up. And when you're able to say, hey, why did I decide to go to that particular doctor? Well, I went to that brain surgeon because they demonstrated that they did A, B, C, D, and I need some work on my brain. Or why did you go to that particular mechanic for your car? Well, they've got these certifications and they know this, that, and the other. We have that same obligation to not discount our career path or our choices, but to educate people that I am a peer and I'm able to do that because I have training, and that helps reduce the stigma. We have to be aware that there's a cultural complexity to busting stigma and help people tailor that approach to listening to what is the barrier. If you or your peer that you're helping run across something, is it based in fear? I know when we were opening our sober house, um, our law enforcement were so behind it and our ambulance service, but all of a sudden we had some people, because they were lacking in knowledge. They thought this house was going to have sex offenders who were actively using, and they made this huge narrative up. And for us to be able to culturally share that you don't need to be afraid of somebody that is in early recovery, somebody that's volunteering to be actively accountable in their life. You should be afraid of the people that are still in their basement using, not the people that are trying to change. So listening into all the conversations as a peer says to you, I don't know exactly how to approach this situation. Just try and step into the other shoes and realize what is the person really afraid of. Oftentimes they just need knowledge about what is the real truth and the facts, not the stereotype and the stigmas that you hear about in the movies and the sensationalism of half truths. The other part of busting stigma is that we each have to maintain our professional boundaries, make sure that we have a relationship with the clients that respects confidentiality, respects boundaries, because that gives credibility to yourself and to the field as a whole. So role clarity in professionalism and in resiliency, we need to be very aware that you can easily get into emotional drift. Every single person that joins the helping profession, we are wired to connect regardless of the content and the context of how we're trying to connect. We want some emotional closeness. We feel some attraction. That person's really cool. I like the job that they're doing, or the way they parent their children, or the fact that they're a great tattoo artist, or whatever it happens to be. And that wanting to identify can shift those boundaries over time, and you can get an emotional connection that is not in a healthy way. Um, we also need to make sure for our own resiliency that we normalize the willingness to talk about transference and countertransference. Um, there's been some really cool people that I've had the ability to work with, and I'm like, man, if I had met them in another way, I would be friends. I'd be inviting them to coffee and saying, let's go to the pool and swim together and, whatever, whatever. But making sure that you are having a comfortable relationship with a supervisor, whether that's working for an agency that has that built in, or you have to connect with other people because you're working one-on-one and you don't have that built into a system that you're working in a care, but making sure that you have somebody that you can really discuss what is a therapeutic relationship and what is not a therapeutic relationship, because we can't become friends and rescuers or surrogate family members for the pairs that we're doing. We're really working hard to come alongside and work ourselves out of a job. We want them to connect with all these other people, and we role model the connectivity, but we are not the end goal. I'm going to pause for a second if anybody has any questions or comments about how they have felt vulnerable talking through a transference or countertransference with a colleague or a supervisor, or any clarities around how we need to really define our role. Okay. That means I explained it so well, or I didn't explain it well enough. So one of the things that I like this quote is, under duress, stress, strain, you will not rise to the level of your expectations. You will fall to the level of your training. So the fact that you're coming to a training has already gotten you above where other people might be, um, because we think we're going to do good work, but if we haven't had some muscle memory practice, we might fall short.
Debbie,
Yes.
we did have a couple of comments in the chat. You
Ye-
just didn't, they were typing. Uh,
Okay.
so Erica says, I use the work myself out of a job phrase all the time. Oh, I
Mm.
use the work myself out of a job phrase all the
Hmm.
time.
Good.
And and then Lisa Johnston added, I always begin with strong boundaries that I verbalize to the peer.
Hmm. Those are two excellent things. I really like what Erica said around, or excuse me, Lisa said around setting strong boundaries. You can loosen up a boundary a whole lot easier than you can re-establish one that was sloppy at the beginning. So great, great share, Lisa. Thank you. So, what are some of the common pitfalls to having those healthy boundaries? And I have looked at several themes. And I looked at Idaho particularly. I have the honor and privilege of working on the Idaho Board of Alcohol and Drug Counselors, and they do the recovery support certification. I also reached out to those that had peer supports and asked what are the biggest complaints or grievances that come into the licensing and the certification boards. And they're probably not uncommon to know, but one of them is what I lump together called the common sense trap. And this is the vulnerable spot where it makes sense to me, therefore it's the right decision. And that theme really is taking my own knowledge and skills, my own cultural perspective, and making my own decision about this situation in isolation. And you're going to always step into problems because you might not have enough knowledge or skills, and your perception of something is only your perception. And depending on our day, we can have very narrow perception or we can widen it out, but there's none of us that can see a whole picture. So be very careful when you're coming across something that you've got some intuition about. Am I stepping in a boundary? Am I being clear about an expectation, to have others that you can consult with and talk with. Because if not, we'll make our own decision and we will be able to rationalize and justify it all in our own decision making, all by ourselves. The other common trap I call the circumstantiality trap. And this means that I can never see anything as right or wrong. I see absolutely everything as situational. And the trap here is you will be a ping pong ball all over the place. And it'll happen in two realms. We are never the same every morning. You know, some mornings I wake up and I'm so excited and energized and I feel resilient, and I'm probably going to do work in a different way than, man, I didn't sleep well, or I've got a little tummy ache, or I worked with a really tough situation, or I have an aging mother and I'm like, oh my gosh, I'm worried about my mom. She fell, or whatever. And I'm going to come and show up in a different way depending on my skill and energy that day. And so if I go into every situation thinking every situation is gray, I'm going to be more likely to respond to what's given to me and presented. And our peers that we're trying to help present in so many different vulnerable, raw ways. Sometimes they present as defending and they're going to only show you the good parts. Sometimes they show up in their most raw, vulnerable, and they don't look like they have any strengths at all. And you might want to wrap them up in all your love and support and do everything for them. So be careful of the trap that there is no right or wrong way of doing things, because what you know, if you've been in these trainings before, there are common evidence-based practices that we've been taught around what are the road parameters that we should be doing. And then the other pitfall is putting our personal values and opinions over our professional standards. Um, I will go there. We may believe as a personal value that every single human being has the right to health care and the same quality of life. And yet we live in this great country where there are so many funding sources and injustices of how is it that somebody can work for a company and they've got great insurance and somebody works for a company and they don't even get paid a living wage where they can pay their copay, and somebody else doesn't qualify for Medicaid, and someone else was born here but they ended up in a different country and they came back and they're not a legal alien. And so our personal value can cause us to not help a peer navigate the difficult system in a way, or we could endorse that we'll just be quiet on that matter. We'll ask forgiveness later if we need to. Or somebody else might have we'll use the other extreme. Somebody else might be, every rule must be followed always. And is that going to be in the best interest of that person? So really reflect on your personal values and opinions and understand the culture that you're working in, understand the rules and parameters of the organization that you chose to work for, understand the funding sources that you have chosen to help pay for the resources that you're working with. I'm going to pause and see if there's any questions or comments. It's always a challenge. You guys can jump in, so feel free if you need to. Or if you're like, I can't type fast enough, I just want to open up my mic and ask a question, feel free. Absolutely feel
So
free.
Debbie, Deborah did make a comment. She said, I explain how I'm here to walk alongside you until you can walk alone.
Yes. And Deborah, I think there's also another step in there. I'm going to walk alongside of you until you find a group of people that will walk alongside with you, because my core value is I don't want anybody walking alone. But I know I can't always be in your life. And so let's put some other people in your life. And, sometimes let's try and figure out people that you don't have to pay for services. You don't have to pay to show up and get those services. Yeah.
And Dee also put in a comment, read your company's code of ethics. They do not always match ours.
Yes, and I think what you mean by ours is the peer support code of ethics or the recovery coach ethics. And there are times when an organization can be driven by other types of goals and opinions than the certification. And that's where, who do you work for? What are their core values? Sometimes just pointing it out, they're like, oh, I didn't even know that that was a conflict. So, and that's the advocacy for the field and helping reduce the stigma in the field.
I
Yes, go ahead.
oh sorry. Yeah, I on the circumstantiality trap part of there can never be a right or wrong. I was just curious or gonna comment about how it seems like that's such a delicate balance of wanting to support them, obviously not guilt anyone, not trying to make them feel worse than they already feel for on themselves, as well as to try to educate and steer in the right direction. So is that kind of what that point was meaning? Am I understanding that
Yes,
correctly? Okay.
you are, because um, there are some right and wrongs in our
Mm-hmm.
field. Like I'm not your friend. It's actually the
Mm-hmm.
next slide that I put here is I'm not your friend. And if you are regularly as my peer, referring to me as Debbie, you're the best friend I've ever had, and you're great, and you're my best friend, and you introduce us when we're out trying to help you navigate getting, a food box, and we walk into some place and they're like, oh yeah, my friend brought me here. If I don't challenge that person, not shame them in public, but if I don't sit down and say, my role is not your friend, and so let me help you define what a friend is. Let's do some knowledge about that. And what does it mean to be in a role where I am paid to help you with some skills? I have a lot of characteristics that are in a friend, and I appreciate that you see those, but I want to help you move forward into finding people that are like me that have these characteristics. And hey, when we talked about your friend, George, or your friend Sally, they've got some characteristics that seem hurtful, not helpful to your overall health and wellness, that's where you know that there is a right or wrong. Is that
Yeah.
helpful?
Yes, it is. That helps. That helps greatly. I had to even bring up in one supervision meeting. I'm such a kind of just a social, nice, the way that I talk in general. I had to make sure to kind of check and adjust versus I'd ask a supervisor when I'm texting them to confirm the next day. I would say like, "Hey, friend, are we still on for 11 o'clock tomorrow?" Because to me, in my personal life, but then when people, as we know, are struggling with the emotional, mental, it's like I don't want to lead them on and miss. And so it felt almost like cold to me to be like, "Hey, Michelle," or "Hey, this person," or "Hey," it's like that's not the normal way that I speak in my personal life. So yeah, I get it. There's just these fine lines and check balances, I think, for sure.
Yes, yes. And I think it's Leah who just made the comment that sometimes we can't correct peers in the moment because you're not going to violate their confidentiality if they present you in a certain way. But the slippery slope into a vulnerability for you staying in the field is if you don't have that conversation that might feel a little tough at the next most appropriate time, not just ignore it and think it'll go away.
Sandra has a comment also, Deb.
Go ahead. Yes, let's see. Who can see messages recording on that one?
When
Sandra
meeting with a
Gomez.
peer, we usually
Oh,
do a
okay.
check-in with who is someone you have that is in your support system as well as a strength they have discovered.
Yes, yes. Perfect. Thank you. I don't have anything to say other than yes, I agree. Yes.
And there's one more that just came up from Lisa.
I just need the text so I could save that.
Great. You go pre, how do you want us to introduce ourselves in public? If they want to say friend, I have to let them know. I can make sure my own professional role is clear. Yeah, you don't have to be like, hey, I'm here as the recovery coach, or the peer specialist, but you can say, I'm Debbie. You don't have to say I'm Debbie, her best friend. So there's a compromise in the middle between they want to call you a friend, you want to protect their confidentiality. Okay, so we've clearly defined, haha, your role, and we have really described how multifaceted, important, lots of things. So now I want to just really focus on some skills that you can have for yourself and skills that you can have for using with peers. So according to the National Institutes of Health, there are 5 rules of recovery. Whether you're talking any of the states is we are trying to help people gain awareness, get acceptance, and then turn that into action. So we're saying, how are we going to change your life? How are we going to be completely honest so that we don't have barriers and we can get there? You don't have to be honest with everybody every moment, but who's the people that you can trust? How can you have the courage to ask for help? How can you practice self-care and don't bend the rules? And those rules are not institutional rules or societal rules. They're the rules around what do you know that you need to do for your own resiliency. Whether that's like my morning routine is X and I don't deviate from that. Very, very rarely. I might shorten something up. I might shorten it on a weekend, but overall, you're going to see me wake up. I start my day with prayer and meditation. Then I go and I get my contacts on and I go and swim. That's what I need to do for me. Then I come back and I start my day because that's what works for me. But really, the role of recovery is how do we stabilize people? How do we help them create a self-care plan? How can they learn to trust a process in their life that we call recovery? How do they find a community of people to do that with? And how do they continue to explore their own and expand their own self-awareness and trust their intuition and their gut? We all have it, but when you're struggling with addiction or mental illness and the stigma from society, you stop trusting yourself because your disease and your struggles have made you not reliable and trustworthy. You lie and you deceive yourself and other people. So recovery is learning to trust yourself, have a community of people to do that with, and creating a care plan that works for you. I like Lori put the 3 A's. Yes. So what do individuals in early recovery really need for success? You want to throw some things into the chat, or anybody want to just open up their mic and share? What do people need? If we know that we need to increase the awareness, help them with accountability, put them into action mode.
I think, sorry, eating my bagel, joking a little, but I think that setting those expectations and boundaries and making sure like they have a chance to set their own expectations as well for what, you know, times we're going to meet, everything like that, and just having set expectations of what direction they want to move forward and making it clear that it's not anyone else's choice but themselves.
Very good. Yes. I see honesty, have communication with people. Yeah, remain focused on the goal. Fellowship, that's that community part. People need to not be alone. Goals, hope, support, determination. Yes, the grit, determination, chutzpah. Yes. Support and verbal positive reinforcement. Need to be heard and have a voice. Support, community, short-term goals. Absolutely. You guys got it. You understand. Respect. We haven't talked about that yet, but respect. Absolutely. Get this machine over here to work. How I would say it is people need resiliency. And the definition of resiliency is a process or a lifestyle that enables a person to bounce back in the face of adversity. Because it's not like, are we going to have adversity? It's we are going to have adversity, and what are we going to do? And to be resilient, we need guidance and reassurance that we can get through tough things. We really can. We can do more than we expect of ourselves. So the resiliency theory was developed over time as people started to get exposed to and successfully navigated tough situations. And the resiliency theory, I put my source here, so if you're wanting to go and read, Dr. Green is amazing and has really looked at what made people resilient and what didn't. There's some research now about like what COVID and all the isolation did to people. So this is where I pulled this information from. So resiliency is the treatment and the peer support of recovery coaches. Our goal is to build resiliency into people so that they can navigate life better than they previously did. It's not that they have to live life the way I say it should be or the social media says it should be, but they get to define their own goal. It could be a little teeny tiny goal. It could be a big goal that's broken into parts and pieces, but that they define what is okay and what's not. And that means there's a lot of unpacking of things. There are things that they have to unpack, such as family trauma. They have to unpack the legal implications of what happened in their life, or unpack the poor me's on why did I get this disease and other people didn't have it so tough. But they define what it means. The 3 central principles behind resiliency theory is that we all have risk factors, we all have vulnerability factors, and we all have protective factors. And the 3 of those together is really what makes up our whole resiliency mechanisms. So first I want to talk about things that we probably already know. And these oftentimes are the social determinants of health, but they call them the risk factors or the mechanisms that cause people distress in their life. Things that sometimes you can't control: poverty, lack of family or community ties and connections, addiction and mental illness, dysfunctional family environments, And that could mean, the overworking detached family. It can be the enmeshed family. Families are so many different ways, but it's the dysfunction that happens where people don't have their own identity and their own ability to feel safe in their environment. Chronic illness are risk factors that sometimes are not in your control, particularly when you're a child. You can change them as you grow up, though. And then there's vulnerability factors. And these are the traits or the genetic predisposition, the biological things that cause somebody to be more heightened or sensitive to stress. Things like some people have cognitive impairments. If you have a lower IQ, oftentimes you're going to be distressed over things because you don't understand it or you can't process it as quickly. People that are predisposed to emotional dysregulation, people that have high anxiety, they're going to be vulnerable to things that others aren't. The mood disorders and the addictive disorders, because they have your emotions bouncing all over the place all the time. Lack of social support, lack of effective coping skills, and an overall poor physical health are the vulnerability factors for lack of resiliency. What I really want to talk about, though, because we can't often influence those first two, but we can influence the protective factors. And there's two big categories of protective factors that help people resist resiliency, or excuse me, resist the stressors and build resiliency. And one of those is the assets or the positive factors that reside in us. And some of those, we're just all born differently. And some of those we can actually increase. So self-efficacy, like I am my own guide, I am my own person. That allows you to have your self-esteem, that I am worthwhile, I'm uniquely made exactly the way I am, whether you have a religious understanding, a spiritual understanding, but just realizing that you don't have to be like anybody else. You just need to be like you and figure out how to get comfortable in your skin. Also, assets of social competency, and many of those are communication skills. And as a peer support, we can help people read the room, understand how to navigate multiple environments, because those are factors that make you more resilient. If you feel like you can navigate a situation, it's not going to be scary and you're not going to isolate as much. The other protective factors are lumped into the resource factors, the social supports that we can learn and practice, and the wellness programs that really support our biological health. We've all told, like, sitting around being inactive is not helpful. And you don't have to run ultra marathons. There's something in between sedentary life and ultra marathons, and each person can figure out what their wellness program looks like. Mine, it's swimming. Somebody else's, it's yoga. Somebody else's, it's walking with 3 friends. It doesn't matter what it is, but creating factors that will help you build your resiliency. We'll pause it. Whoops. I'm too far. Got to make sure I put my mouse on the right screen so I can look at the chat box. So what do we really teach in that early recovery stage of somebody that's newly diagnosed with a mental illness or is in early recovery from their substance use disorder? We are teaching them coping mechanisms all the time. We are teaching them that they have their own autonomy, even when somebody else is telling them what to do. I have a problem because my parents tell me X, Y, or Z, or my significant other says this, or my probation or parole officer, or my children's protective worker. No, you still have autonomy. You still have choices. You have to learn how to navigate through some accountability processes from the past and where you want to get to your future, but you do have control, and reframing that is one of the things that helps people in their resiliency factors. Building a positive character. And what do you think I mean when I talk about somebody's character? Any thoughts? Anybody want to open their mic and talk about what you think what character means, or what brings character to someone?
I think I think character means like, and maybe I'm getting it mixed up with morals, but like integrity, that you're going to do the right thing and somebody can depend on you. If you say you're going to be there, you're going to be there. Or, you
Mhm.
know, if you're doing meds, you're not going to sneak one or two of them, you know, you're going to be honest and straight up.
You hit it. Character means that you have qualities that are distinctive and you do what you say what you're going to do. It's your uniqueness that makes people attracted to you. Because if we're lying, deceiving, cunning, baffling, we can't trust ourselves. So we're not going to have an energy that we put out where people can go like, huh, Debbie's reliable. You know, she's got a good character to her. Why do we as employers sometimes say like, I need a character witness, or, you know, people that have gotten involved in the children's protective case are like, oh, we need a character witness. Like, how are we going to know that you're a good parent? And really what it goes down to is people say what they do and do what they say, and being rigorously honest in a safe environment of, I can present really well, but there's some broken parts and pieces and I'm working on this and I got this under control. That's learning in early recovery who you can safely share that with and who you can't, and who's going to be there helping you learn those skills. And that's why a recovery coach or a peer specialist helps people with their character and defining what they think is important. Like, what would attract people to you? What would make you fall in love with yourself moving forward, instead of loathing that I'm not good enough because of my bipolar, or I'm crappy parent because of my addiction? Or how are you going to give some self-love and connection to yourself so that you'll be somebody that's worthy of others wanting to connect with? So coping mechanisms are three types of things. When we say to somebody, I want to help you learn to cope better, one is we need to help people realize that there's a distress tolerance and you can get through that. And this is where knowing the cultural background of the person you're working with, um, the socioeconomic factors, you can use so many things. You know, some people today, I was sitting at lunch with one of my team members and they had done one of these triathlon mud challenge. I don't even know what it was called, but they like were running. And then if you missed a challenge, they were jumping over things. And if you're like, well, I want to pass that challenge, you had to do burpees. And, you know, they were doing this physical thing with their body. But the whole theme was, well, I didn't know I could even tolerate this much. It was cold and it was hot and it was this. Spartan or mud runs. Yes, thank you. But why could somebody do that to themselves? There's something culturally that they're like, I want to challenge myself. Somebody else might be, I can't tolerate noise around me. Well, you know, I kind of like a quiet environment at times, but I could tolerate if there was a dog outside barking. Nothing terrible is going to happen to me. But what do we need to teach that person? Well, maybe you need to put a barrier between you and that barking dog, put some white noise on or music. But people that don't have emotional resiliency or distress tolerance, the first thing is they think is, I can't tolerate X, Y, or Z. I can't tolerate being cold. Well, you probably can tolerate it. And you probably can put a barrier between you and that distressful situation. But if you don't feel like you can, you're not going to be able to cope with it or even want to come up with a problem to solve. So for me, learning to cope with resilient or building resiliency and learning to cope, you have to learn a cultural context. And sometimes that is asking the person who in their world, in their friendship, their family, who do they see as coping well with things? And then asking them to define some characteristics that they know about that person or that they've projected onto that person. If they have a relationship with somebody that they know from afar, it's great to have a person interview somebody else about well, gosh, you look like you have all your stuff together and you're able to cope with these emotional things. Well, I only do that because I've set a routine in place where if I hadn't slept for 4 days and I hadn't eaten well and I hadn't done some of this basic stuff, it's going to be harder to cope. And if I didn't ever think I could cope, I'm not even going to try. The other part about building resiliency is the control or the autonomy that we talked about earlier, is you have to have some source of internal understanding of who you are, like your own personal identity and ability to act independently and exert some control. If not, you are a victim of every circumstance. You are vulnerable to all the environmental factors around you. And we know at times we're not always around the most healthy people. Sometimes you have to go to a job and you have an entry-level job and you are working with people that are emotionally dysregulated. They're not doing what they say, they're causing you distress. And if you don't feel like you have any control and you're choosing to put yourself into that situation versus, can I change the situation? Can I change who's around me? Can I change what's important in my time? Are there things that I can change in a situation instead of saying I'm just a balloon in the wind being blown by whatever happens? So can anybody share with me some examples of how you help your peers work on their own autonomy aspect? So Erica says core values are a major part of resiliency for her and the peers she works with. I would agree. Role playing. Yes, Stephanie. Mm-hmm. Verbal affirmations. Mm-hmm. No. We go through the 8 dimensions of wellness. Yes, I think we're going to get to that here in a little bit. Encouragement. Mm-hmm. Because if you don't feel like you have a possibility of changing, it's not going to happen. Boundary setting. Yes, Teresa. One of the things is being able to listen and see your peer and you pulling out the characteristics and saying, I see this in you. Does that fit? Because oftentimes they've been so beat down that they don't have any idea of what's a positive situation. Let them choose their course, review the results in a positive, safe environment. Mm-hmm. Let them, yes, independence training, encouraging, motivational, reflecting on past successes. Absolutely. Building upon the little teeny tiny things. Confidence. That's exactly what that leads to. What do they feel like their strengths are? And a lot of times it's going to start out with, I don't really think I have any. I always am messing things up. I don't really think, my sister's the smart one, or my brother's the athletic one, or, I don't have any money and I don't have any strengths because they've beat themselves down or the systems that they're in. So being able to come up with ways that you could pull out in a resilient way, sometimes it's the littlest things. Like, your smile, I've noticed that you really smile. You smile when you're nervous and not comfortable. You smile when you are comfortable. But when you smile, that's a strength because you put other people at ease. You sometimes have to dig really hard to help them see and build upon what they can't see. The other question that you can work with people is, how do they get through a difficult situation? Going all the way back into their past, if they really can't ever see where they had a strength, well, who's somebody else that they saw get through a difficult situation, and asking them, well, what do you think happened in that one? Helps build the confidence and boost that there is some opportunity to not be a victim. We also, for confidence building, can help people identify those self-defeating thoughts. What are you telling yourself? And not just what's the self-defeating, but how are you going to counteract that? And then how are you going to bring people in your world that will help you counteract things? Any other examples of how you guys build self-confidence, or the type of questions you ask of your peers when you're trying to help them build confidence? Giving them voice and choice, yes. Saying that they get to set the tone, they get to share what is important for them. You're not setting the goals, they are. Look for the helpers. Tell me more if you're needed. Ask them if they can't think of a strength, what is a strength they would like to have? Absolutely. Fake it till you make it. If you're like, well, I'd really like to have confidence when I do X, Y, or Z. Well, what does confidence look like? Can we go and practice that in a safe environment? Mm-hmm. No. Using motivational interviewing techniques, being their sounding board. Mm-hmm. Absolutely. Yes. So once we have the confidence built, then we need to go into helping them build competency. And this is where goal setting is very important to do. So if you have the ability to navigate your emotions and you can have a successful problem be solved, then, oh man, I have some confidence in that I can tolerate a noisy environment, or I can tolerate mud and cold. And those are just the examples, or I can tolerate the side effect of this new medication that I know I need, even though I don't really want to have to be on this medication. But when I'm not on this medication, my emotions are all over, or I can't get out of bed. I can't be successful at work. So helping them reframe each choice and then find the competency that they followed through on. Also having the person stop second guessing themselves and reframing that wording into, you have made a informed decision about something. You have set some specific goals, and you're not a failure if you don't make the goal. You have now the opportunity to reevaluate it. It's a total continuous improvement process instead of a I'm a failure process. And that does so much for our own emotional resiliency and our willingness to pick ourselves back up and try again. We know, all the big innovators or say, like, I made more silly things on trying to figure something out, and I learned more from my failures than I did my successes. So helping that person stop the negative self-talk and move into, I really am competent, and I didn't derail and crash off the train tracks completely. I just needed to pause, and now I need to recenter, reevaluate that this part of it worked, this part didn't. Keep doing the part that worked, put in a new goal, and reevaluate the next part. The other part that many of us as human beings, but people that have some of these vulnerabilities in the environmental factors or the emotional factors, need to practice saying no and practice asking for help. There are so many people that just whatever's in front of them will follow whatever's there. Whether it's the healthy family, the unhealthy family, you must do this, you should do that. No, set your own tone, your own pace, and realize that you can say no to certain things. Is a huge resiliency factor, because there's only a certain amount of resources and energy that any one human has in 24 hours. And realizing that you're not a failure when you ask for help, that's a strength. And saying no is a complete sentence. No means no, not no if you means yes if you harass me or guilt me, or you promise me something. Sarah, thank you. Your smile was great.
Debbie, there is a comment by Lori that when they make a mistake, I point out they have an opportunity to learn something from it, so it's not a mistake.
Mm-hmm. It's a learning opportunity. Even if we just change that, instead of like, I'm always making mistakes. No, you are on a life journey of learning opportunities. Just flipping it to a positive or a neutral or positive statements to yourself. The other thing we can do about peers is notice, praise, and critique. Just like that, when Lori's saying she notices some negative self-talk there, she's praising that, nope, that was just an opportunity to learn. And you're giving just a little critique, kind of like if somebody's like, oh, I'm an artist. Well, you might be better if you put a little more gray here. Or they're not saying, oh, that painting's terrible. They're always in the arts learning to get feedback from others and willing to get critiqued on things. And people that have really good resiliency in life are seeking feedback from others, and they're seeking feedback almost always from people that they trust and value. It's one of the really hard things to teach people of go to your supervisor and build a good relationship, because you should be asking for continuous feedback. If your goal is to follow the mission, you chose the job for a reason. You can't make good, healthy, resilient decisions alone. So yeah, I like that, what Lori shared. The other thing about competency building is that hopefulness message that we've talked about before, is help the person get out of their own way and allow themselves to do things, experience it, and take chances. Because if you stay stuck in that, I can't, I won't, I shouldn't, it's scary, I'm not capable and competent, you're not going to do anything ever except for just sit in your own little bubble, afraid, and all the stereotypes that we should wrap you in bubble wrap because the world's a dangerous place, versus, I'm going to try this. I'm not going to try this and jump from the boat to the dock without realizing that the dock's floating and there's a distance. I'm going to make sure I get close enough that there's a chance that I'm going to land on 2 feet. But I'm not going to be afraid to take a chance. And then relying on the assistance of other people. It is a strength to ask for help. It's a strength if you are trying to jump from point A to point B and somebody else has already done that, and they can say, the easiest way to do that is your right foot forward and your left foot back. Or the easiest way to climb under that thing is put your head down first. Otherwise, you're going to get it whacked off. Things that you might think are common sense because you've done that challenge before. Other people might not. And navigating the systems where people are like, there's no way I'll be able to, get the HUD housing form filled out. Oh, there's no way I can apply for Medicaid. I can't get through these systems. Yeah, you can, because somebody else has done it beforehand. And here's the first trick. The first trick, we're going to do it on Tuesday, first thing in the morning. Don't ever go on a Monday because everybody's there and they're all mad. Whatever the example is. Don't try and accomplish anything in Gooding, Idaho on a Friday that has to do with any system. They work Monday through Thursday, 4 days a week, and they don't answer their phone. They're not there. So don't try and do something you're going to feel like you failed. So asking for help and knowing that other people have helped navigate things is powerful. Oops.
Debbie, there's Erica had her hand raised.
Oh yes, Erica, unmute.
Yeah, I just had a question on that last one. Like, I know for me it was really difficult because I am a talker to learn how to like sit in the silence with people instead of like trying to jump in and fix it or figure out what they're thinking, because some people just need to like process. And I was just wondering if that kind of falls into the competence part, like allowing them the time to process, even if it's uncomfortable for me to sit in that silence. But most of the time, it will get to a point where they will say something and speak for themselves rather than me speaking for them. Does that make sense?
It does, because when we get uncomfortable or we think we know the answer and the easiest way to go through something, we're going to give them our values, our perspective, our strengths in getting through it, through a system or a situation. And that is doing disservice to them because their strengths are not the same as yours. Their perspective of how important something is isn't the same as yours. So sitting in your own uncomfortableness and being able to say, okay, so how do you think you would navigate this? And when's the last time you practiced this? And if it gets to the point where they're not sharing anything, instead of it being my idea, it could be, well, like, here's 2 possibilities of how you could navigate this. Which do you think uses your strengths? And which one do you think you might want to pick, so that it's not Debbie's telling Mary how to do this, Because if it's successful, it's Debbie's success, not Mary's. And if it's a failure, it's my fault, and Mary doesn't have to have any accountability for it. So that's a huge example of how a peer needs to learn to sit quiet and help set reasonable, realistic goals that are driven by the peer themselves, not driven by ourself or the PO or the Child Protective Services worker. Yeah, because you'll steal their pride in it when it gets done, or you'll make them a roadmap that's not theirs. It's yours.
Thank you.
Is that helpful?
Yeah, I just wanted to just popped in my brain with the whole competence thing. So thank you.
Yeah, thanks. Good question.
Debbie, there is a comment from Tiffany. I always point out anything that they do positively and state, look, you did that on your own, to help their confidence.
Yes, perfect. Anytime we can hold the mirror up, we're trying to increase that awareness, because we can only see what we can see. And I love to tell clients that are a little bit reserved, not, don't have a lot of humor or joy in their life. And I always use the example of, if somebody came up to you and said that you had a tail growing out of your backside, what would you think? And they're like, I think they're messing with me, or haha, yeah, right. I said, well, what if your friend who you knew pretty well came up to you and said, you have a tail growing in your backside, and what would you think? Well, would you give it any more credibility? Well, what if 3 really good friends said, you got a tail growing at your backside? Don't you think you should at least look in the mirror? Like, trust that people are going to give you observations that are helpful to you if you're picking out the right people. And the fact that the individual has chosen to work with you as a peer support or as a recovery coach, they have some trust, because we know a lot of times they drop out after 1 or 2. So you've got some credibility, and being able to give them awareness is exactly what your role is, to help them build their competency and confidence. The third part of resiliency for any of us is the connection factor. Because if we remember Maslow's hierarchy, we need to have, a stable place to live and sleep, and we need food, and what's the ultimate part is connection, self-actualization. So connection is something that we all strive for. Even the introvert and the shy person, they don't want to connect with a bunch of people. They just want to connect with 1 or 2 lower energy, calm people. That really gregarious person that thrives off of energy, they might want to connect with more people. But we all strive to be in connection with someone, because when you're in connection, people see you, they understand you, they value your opinion about things. And that helps us with resiliency. So the fact that you're working yourself out of a job only as helpful as if you work them into connection with people in their environment. The other part about connection is it has to be a safe environment. Some people can't go back and connect with their families of origin. It's too chaotic. People haven't done any work, and they will relapse into vulnerability when they're in that toxic environment, because they go right back to being the rescuer or the 9-year-old victim or whatever it happens to be. So creating goals that they get to figure out, what is a safe environment for them? How long can they be in a certain environment? How many people do they need in that environment? Who are the types of people? And then going out and finding places that that environment exists, or developing that environment. The other part about connection is you can't have a lot of energy on connecting with other people if you haven't got your basic needs met of financial stability. Do you have food? Do you have a place that you can sleep at night? Do you have basic medical care, dental care? If your teeth are hurting, you can't do anything. So a lot of our introductory role into helping people navigate systems is getting those basic needs met, because you can't get any further along in building resiliency until you get Maslow's hierarchy started. And then if they have those basic needs met, that connection and social support is a vital role in the peer support specialist or recovery coach, because you're helping them expose themselves to people that assist them in a hopefulness outlook and a positive outlook. You're helping them connect with people that don't drain their energy, but add to their energy and to their ability to enjoy life or to navigate when life throws them a curveball in a difficult situation. Questions or comments about connection?
I had a quick question where you had said, and I don't know if this was the last slide, here are two possibilities or outcomes, which you think would work best for you. Is that the way that you had phrased that? I kind of need help pointing them better in the direction of directing themselves versus me. I thought you had said another one, but I can't remember.
I'm sorry, you were breaking up just a little bit, so Mary might have to help me. So when I was talking about giving people two opportunities instead of you sharing what your values and your goal setting would be, is to ask them what their two options are. Is that what you're referring to?
Yes, exactly that. Here are two
Mhm.
possibilities or outcomes. Which do you think would work best for you?
Mm-hmm. Mm-hmm.
Okay.
And then the rest of what I was sharing is being able to help that person have the autonomy that sometimes, like, did you see this in another person? What is the strength? Or if they get struggling with, it's like, well, if you choose this, you're going to have to use more of your energy to connect with people. If you choose this option, you're going to have to be doing more of your own research on something. For example, you're going to have to increase your knowledge versus, if they're trying to navigate a system along the way. I'm not sure if I'm muddying it for you or not.
No, that's great. I appreciate it. That's a great feedback, and I did want something verbatim, so that's very helpful for me. Thank you.
Ian says, I have a hard time with some places because of trauma, and because of that, my anxiety can spike at times, but I try exposure therapy to get myself over the stress and trauma. Absolutely. That's building that resiliency muscle. If we've had trauma in whatever way, there is some exposure therapy that can work, but exposure therapy can only work if you have a safety net around you, or you've built up a muscle of emotional resiliency, exposure, how long you're going to do something for. If not, you can set yourself up to be overstimulated, and knowing, like, what are you going to do to self-soothe after you expose yourself to something and then step back in. We do a lot of that with people that are like, okay, I'm going to go back out into the world and I'm going to visit my family and my extended cousins. And, I'm going to go the first time to some family get together. And all of a sudden you're like, I'm trying to be sober there and they're all drinking. What are you going to do in that environment? You're going to set the words of, hey, I'm choosing not to drink anymore. Well, in some families, that has set yourself up to be teased, ridiculed, and they would force it on you more. Other families would be like, well, my exposure therapy is I'm going to go and I'm going to pick up the red Solo cup and I'm going to fill it with water and I'm going to hold it and I'm not going to let anybody take my cup from me, and I'm going to pretend and I'm going to fake it until I get stronger because I wanted to go to my cousin's wedding. So having that autonomy to figure out that somebody be like, well, that's lying. You can't hold a cup and pretend you're drinking when you're sober. Why not? It's my navigation and my exposure to what I'm trying to figure out. Could be a year later and you're like, I don't even want to go to that family event because it's too distressing to me. Or it could be a year later and you're like, I'm sober enough that I'm like, I don't drink. You can if you want to. I'm going to be here for an hour and then I'm leaving and I'm going to go do something fun, ride my bike or go to a meeting or whatever. So it's all that person's own plan, because what works for one person doesn't work for another necessarily. And the other resiliency factor is what works for you at one's time is not going to be your end all be all. It's going to change as you change and grow, because we're changing and growing humans. That's just what happens. That helpful? Oops, let's see. One other thing that we need to know in skill development is how to handle crisis or unhappy events. And what does that person need to be competent in that situation? And here's several things that I think we need to know as we're building resiliency in people is we have to help people understand that even in a time of unexpected event or a crisis, we still have control. We have thoughts and reactions. We have the ability to understand what is and what is not in our control. So many times people immediately go to, I have nothing in my control, and I can use an example of something very tragic, a family death. That's a very unhappy, unexpected thing if somebody dies, but there still are things that you're in control of. We are always in control of our thoughts. We're always in control of how we react to something. We're always in control of our own behaviors, and we're always in control of the environment that we're doing that in. And what I mean by that is my thought can be, this person died, that's terrible and awful, my life's going to never be the same. That might be actual, but if I message that, I'm going to feel less powerful than, I'm really, really sad, I'm going to grieve this, and I need to get really healthy people around me now because I'm having a hard time. Hear the difference just slightly in your own thinking. One is I'm a victim and I have no control. The other is I don't have any control over the death, but I have a control over how I think about it and what behavior and reaction I need to immediately start. And we're in control of, do I do crisis and unhappy and events in isolation, or do I do them with safe, trusted people? Do I pick the phone up right away? When you think of those of you that work with people that have mental illness or addiction, and you'll hear people say, you've got to get comfortable calling your sponsor. I want you to call me every single day. Well, why? I don't really have anything to talk about. Because I want you to get comfortable picking up the phone, because the day that it's really hard is the day you won't want to pick the phone up because you think I'm a burden or when the person's like, I don't need to talk to you because my meds are doing fine. I don't need to talk to you because I don't feel sad. I don't need to talk to you because I don't feel suicidal. Well, if you talk to me every day, or you talk to whoever's safe in your environment, when life does become a crisis, you're going to be more likely to practice that muscle memory. Why do baseball players or tennis players, they have to practice this perfect way of doing something? Because we're trying to build up an actual reaction when something comes at you. And that's the control factor that we think, well, I don't have control. And we're teaching people all the time of, my life's unmanageable and I have no control over the substances I use. Absolutely. Your brain's hijacked. You've got a neural pathway that's not as healthy as it could be, but you still have a control of how you think and react in an environment. The other thing in a unhappy or unexpected event is to challenge yourself of, is this a threat that's going to, is this truly a threat? Or can I accept that this is a normal part of life? Like death is a normal part of life. None of us get out of life alone or alive. And what is your cultural beliefs, your spiritual beliefs? That's a kind of an extreme example, but challenging yourself on each of those views about, is everything a crisis in your life? Or are some things minor inconveniences? Some things are tragedies that are going to be grieved over time, but not everything is a disaster. But we can wire ourselves to everything's terrible and awful versus, nope, it's just a little inconvenient. This is just a little mosquito bite. It wasn't a huge thing. And then what happens when you start to retrain is you bolster your reserves into positive, healthy interactions. You bolster the fact that you can do recreational things that give you energy. You can learn to do some relaxation, that you build up some reserves, some fuel in your tank for when things are more out of control, because you have a routine, you have an expectation that you're going to navigate the world most days okay, or most moments okay, as you're putting these little successes together. See if there's anything in the chat. Don't see anything at the moment. Then there's some of us who think we can or want to control. Yes. Yeah, it's a fine balance. Some people think that they can control everything, and that's just a different stressor, because a lot of ways, none of us are in control of anything except for how you think about things and how you react to things. And sometimes your body still cheats you out of it and reacts in a way that you didn't want it to. And then you have to be kind and be like, wow, I didn't react the way I really thought I was going to because I didn't sleep for the last 3 days, or this happened, or a bunch of things piled all up on once. That kind of thing.
Debbie, there is a
Yes.
question from Deborah. What exactly do you do to socialize? How do you do transport? I work in an ACT program and most peers don't have transportation or money.
Yeah. So what would somebody do to socialize? You know, one of the great things about technology is there are lots of different things you can do just like us. You know, you can zoom into different things. You can be connected in an amazing way to the world if people can be guided into that. You don't need a ton of money to do that kind of thing. You can, you know, figure out a way to get to the library if you want to. How do they navigate transportation? One of the things that you as a peer could be working with them on is who else likes doing certain things that you like, because somebody might have transportation. And I think of our elderly oftentimes, they are so vastly talented in their knowledge. Sometimes they still have good resources, but they can't comfortably drive their own car, but they've got a car, or they would be more than happy to talk and chat with people. I think back to one of the greatest things, we adopted the grandmas kind of thing. So really thinking outside the box on who can help with different things. And Idaho is a huge challenge because we don't have public transportation where you can get a bus chip. Some places I know, like in my community now, we have TFT. It's the county itself put together transports where it's $1 a ride, kind of thing. Any other people to brainstorm or help Deborah with her question?
Well, I think it was kind of in response to the thing I said about how I run a peer event every week, every Friday, and luckily I have that opportunity. And a lot of it, like I get a little bit of funding from my agency in order to do that. So we do an activity every week, whether it's like an arts and crafts thing or play games, or like movie nights. It changes every week. And then as far as transportation, I mean, it is rough. But like you were saying, kind of finding whether it's their case manager or even I do a lot of the transportating myself, or getting people bus passes that in some cases my agency will cover as well. Like I think a few other people said. And we usually just, it's nice because there's a lot of groups out there that are substance abuse specific. So that's kind of why we do what we call peer event, because it's not specific to recovery. It's not about having those hard conversations or trying to, you know, be focused on something like AA. It's just to socialize. So I was typing
And
it
what
all
that
out,
really,
figured it was
thank you.
good.
That puts it in context. Thank you. I think that also helps people realize that when you do those kind of things, they don't cost a lot of money. You can just learn to relax. You can learn to just, you know, laugh, you know, have a genuine smile, not people not judging you. You can ask other people how they've navigated situations. So yeah, great idea. Anything that does a little exercise and gets people, breathing more and laughing. We did an activity where it was laughter yoga, where it literally was so hilarious. Where it's like, hey, do you think you could do a yoga pose where you kind of pretend like you're pulling a lawnmower to start it? And you're like, and like, oh no, your engine's not starting. But all that just diaphragm work builds physical resiliency, emotional resiliency. When we say, like, when's the last time you laughed so hard you cried, instead of cried? Crying under duress when your body's all tense is such a different physical response than when you're vulnerable and you're like, oh my God, I laughed so hard I thought I was going to pee my pants. It's a different physical response. And it's baby steps. It's hard. It's hard to unlearn all the things that we learned and were exposed to. The other thing when you're helping people build their resiliency is a question that I like to ask almost everyone is, what did I do well? Really helping people realize to go back and self-reflect, because we're so used to saying all the things that went wrong today or this moment or in that crisis or in that emotionally distressing situation. But, you said you had some goals. What went well today? And there's got to be one thing that anybody can think of. Well, I didn't blow up and cuss, or I didn't run away. Helping people realize that they did have control and resiliency and they used their strengths is a huge factor to success, building that resiliency muscle. So ultimately, as a peer person, you are their coach, their guide. And when we think of sporting events, they are giving continuous feedback. You're helping them practice skills. Keep your elbow this way, rotate your shoulders that way. I don't golf, but you got to swing through all the way through. And it can't be just one time, but it's every single time practicing, because good practice makes a permanent lifestyle change. And so you're coaching them on how to think healthier, how to eat healthier, how to move healthier, how to navigate a system healthier. And everybody starts at a different baseline, and giving yourself grace on, can you navigate every single one of those things? Nope. Can you navigate some of those? Yes. Try to get my slides back to the right one. So in the next 5 minutes, I want to give you a framework for some of the change plan goal setting, and you have all these slides. So the first thing is, what do you want to change? And ideally, it should be something smaller to begin with so that they can make it realistic. How is important it to me on that scale of 1 to 10? So like, I want to change, in this example, we have food, we'll do food. I want to change, because I gained weight when my doctor put me on that medicine. I want to be skinnier. Okay, how important is that to you? Oh, that's an absolute 9. I want to be skinnier. Well, how confident are you in doing that? About a 2. Not very confident. Or it could be the other way around. Somebody can have a lot of confidence in doing something, but it's not very important to them. But then you have to help them identify what are the reasons that they want to change. And there's going to be internal reasons and external reasons. The external reasons in the example could be, well, my friends are starting to make fun of me, or my clothes don't fit right, or my blood pressure is going up. So I want to be alive to raise my grandkids or help my aging mother or whatever. And then you make some of those plans for actually what the change is, how other people can help, like people and what kind of help very specifically, like what do you need in that example, and how will you know when the plan is working? That's the measurable objective. And then what are the things that could interfere with this plan? Oh, well, I have 3 birthday parties coming up and I'm going to make a bunch of cupcakes. That might be a little hard if you just decided you're going to eat fruits and vegetables and be healthier. Or I want to put exercise in place, but I can't because I have a hurt ankle. Well, maybe the goal is we need to go to the doctor and get the ankle evaluated before we decide to start running every day. Maybe we should start by walking every day. So realistic goals. Many of you already know this, but goals need to be short-term SMART goals. So they need to be specific, they need to be measurable, they need to be agreeable to the person, not something that you're giving to them, realistic and time-bound. In my last 2 minutes, can I have 2 more minutes, Mary? Okay. Or no, I'm going to take 1 more minute.
Debbie, you have until about 3 o'clock.
Oh, I thought, see, I was going way too fast for somehow I thought I was running out of time. We're going to back up then. Yeah.
Okay.
Yeah. Somehow I thought I had less time than I did. So let's go specifically into anybody that's willing to talk about maybe a particular goal that you're working on with a peer right now. And let's try and go through an example of a change plan and goal setting. Anybody have one that they want to throw out there as an example?
I have one that I can grab real quick if no one else does. Oh. Let me see here.
I see. I love it that you guys are sharing resources with each other. Yeah.
Okay. So for one of my, or I guess an old peer that I used to have, which is probably even better, the goal was I want to get out in the community more. That was his stated goal. And then we break it down into 3 steps, pretty much, or 3 objectives that are, I like to use kind of the 3x3 rule as far as the time frame goes, so that there are concrete, measurable time frames.
Okay.
So like step 1 was peer will attend 1 social gathering every week over the next 90 days. So there's 3 time frames in there.
Okay.
And then reviewed every 90 days. Step 2, peer will keep good attendance at his job 3 days a week and discuss his progress with me over the next 180 days. And then step 3, peer wants to find 1 new hobby to do for at least 15 minutes regularly over the next 270 days. So each one has 3 time frames in there, and this is all kind of broken down, so it's actually moving forward in steps over time. And then we discussed how I will support him through that, and he stated that he will need encouragement and empowerment throughout the process by having me go with him to out in the community to help him feel comfortable in new situations. He wanted to use role playing as a person with shared lived experience. He can prepare so that he could prepare for obstacles moving forward with like getting to work and stuff. And then keeping the lines of communication open and share any concerns or any changes he wants to make in the future. And then we set the expectation to make sure we maintain trust and keep that communication open so that we can have a beneficial peer-to-peer relationship.
So do you have a sense of how he would answer how important it was to get out in the community more?
So kind of how the the steps are set up are which are the most important. That's what we go over is like, okay, what is the most important to start off with? And the time frame with that, like, oh, I feel confident that I can do this in 3 months. So kind of similar to the scale of 1 to 10, but more so in time, I guess. And then as it moves up in time, the more time, the less confident he was in making those changes. And that's why he wanted to put those kind of have that longer time frame, if that makes sense.
I think so, Erica. Thank you. I appreciate you giving us a real live example. And with your permission, I'm just going to share different opportunities because obviously I don't know him and how it all built to this plan. So I'm not judging your plan at all. I'm just, giving ideas based on what could be. One of my things would be when he says, get out in the community more. You as the peer probably know, but the plan itself doesn't really tell us something specific. What is more? Was he already socializing 1 time a week and he wants to get to 3 times a week? Or was he not socializing at all in the entire month and he wants to get to 1 thing 1 time? Because then you know a specific measurable goal of where you're going. And again, you've got measurable things in here, but words like more, we need to make sure they know what more is. Or if I say I want to do less of something, well, what does that really mean when you want to do less of something? The other thing is in a plan, it's good to put down what's the reason behind it. Is it because you're feeling lonely? Is it because you're trying to meet people so you can get rides to work? That's great. If you go to work more often and talk to people at the lunch break, then you might be able to connect with somebody that's in your neighborhood. If you work at a big factory and be like, oh, I drive right by your house. So knowing the goal behind what's important to that person as you're trying to coach them is very helpful.
Yeah,
The other
thank you.
Yeah. The other thing when I first listened to this, all of a sudden I was like, oh my gosh, I got to do a goal in socializing. I got to do a goal in job. I got to do a goal in hobby. I don't know anything about him, obviously, but we also, as coaches, and our systems tell us we have to have these plans, they have to be robust, but do a barometer check-in on, have we overwhelmed a person with how many goals and how many pieces and parts? Because each one of your objectives could be a goal. And that would be fine. They don't have to be, but like developing a hobby, that could be a goal all by itself. Like, what kind of hobbies have you had in the past? What kind of resources to do a hobby? What would a hobby bring to you? Are you looking to sell your hobby and turn it into a business? Like, each one of these can be its own change plan. But really going all the way back to, why does somebody want that change? Because when it gets tough and you're trying to figure out how to give feedback and hold the mirror up, if you don't know the why, then it's hard for you not to just get stuck on coaching them of, well, you said you were going to do 1 social gathering a week for the last 90, why didn't you? And you can reinforce them feeling like a failure if you don't know what you're trying to attract them to or what they were trying to attract themselves to.
Right. Yeah, that totally makes sense. So breaking it down even more, like, because I guess that's just how I was taught, or how our template is, is kind of having a broad goal and then breaking it down into the steps. But breaking it down even more, I could see how that would be more beneficial. And
particularly if people sorry, go ahead.
Oh, I was just going to say, and we always discuss like how it's not set in stone and anything like that. But I totally agree with that with what you said about like how that can reinforce maybe some feelings of failure, because that has happened in the past, and it's also happened in the past that it reinforces like, oh, look, I did this thing. But the why is kind of in a different section 2 where we go on to like the member stated strength and resilience factors, but that part could be a little more fleshed out than, you know, in the actual goal or in the actual change plan, rather than in a totally separate section.
Yeah, and we sometimes make these forms to meet funding and systems, and is it helpful to the person? Because really it's like, what's the goal, making it small enough so it's attainable, and why do I want to do it so that I can really be reinforced, and then who are the people that can help me along the way? Like, because we're trying to create connectivity for people. It's not just my goal alone, because the ultimate goal is connecting people to other people that bring them more joy, bring them more health, more wellness, etc. So thank you, Erica, for giving a real live example. It's often easier when there's something that's not made up. So thank you for your vulnerability.
Yeah, no problem. I appreciate the feedback.
The other thing I want to share about our brain development as human beings, and our brains, particularly when there's been negative things happening, trauma, addiction, mental illness, is that our brain is always pulled back to the known or the old habit, the inertia. So if I've been sedentary a lot of my life, I have not been out there running those marathon mud races, I am going to always be pulled back to what I know and is comfortable. And so realizing that in early recovery, there's a lot of takeaways that we need to do to help a person stabilize in that early phase. So we have to help people build new skills in and know that that takes energy. Like, building a new skill is not as easy as saying, I'm going to go and do A, B, and C. Like, if we go back to the people that have done really tough things, and, you know, our athletes are examples, or our military that have done really tough things. I recently have gone down the rabbit hole of being just inspired by our firefighters, and be like, man, that man or woman was out there on the lines, not drinking a lot of water, sleeping on the ground, and they did it for 96 hours. And then they come back and you see the picture of them sleeping on the concrete, and they're like so happy that they're sleeping on the concrete. But they didn't get there overnight by saying, oh, I'm going to do this. Like, they built up endurance and a teamwork and a camaraderie. So what we sometimes forget in early recovery or new stabilization for people is building this new brain pathway takes energy. And to give some kindness to people, that you need to rest, you need to make sure you're sleeping well, you need to listen to your body. Also, that building new skills takes motivation. So that question of why do you want to do this? And going back again and be like, why do you want to do this? And you can use that in all kinds of different ways. You know, people that have lost a bunch of weight, people that have lost a limb and decide that they're not going to sit in a wheelchair, that they're going to learn to do things. Like, what's their why? Because if we don't have a why, we're not going to have the motivation to put the energy into it. And then the other part of changing the neural pathways in our brain is we have to practice repetitively. Why do we say do a diet for 90 days? Why do we say go to an AA meeting for 90 days? It takes a minimum of 90 days to change the neural pathway in your brain to start something new. If I say I want to, you know, what's an example of something silly? I want to start drinking more water. Well, I have to drink more water every single day. I can't do it just a couple days a week and think I'm automatically going to drink more water. Or I'm going to make my bed every single day. Well, you can't just make it a couple of days. You got to make it every day to change that habit and realize that I need to do that. I also, if people don't believe how hard it is to change, I would encourage each of you to take your non-dominant hand and brush your teeth for the next week with your non-dominant hand. That's how hard it is that we're asking our peers that we're supporting to change. If you just said, like, okay, I normally stand on my right foot and put my left foot into my pants, it's really hard to think, okay, I'm going to put my pants on opposite. I'm going to stand on my. We have so many things that are just rotely in our brain development. So giving people the chance to practice and know why they're trying to do something, and have other people that say, yeah, it was hard for me also.
Everything at once.
And that praise. Go ahead, Pam. Oh, nope, she's not talking to us. Let me check the time real quick. I think there was a couple of things I wanted to share. So yeah, our brain, you know, it takes a lot of energy to implement things and build resiliency. And build your role definition, you know, circling all the way back around of, as you are defining how you're going to help people, I challenge you to go and define what you want to do as a recovery coach, as a peer specialist. Make sure that you know your ethical value of why it's important. Be non-negotiable on your own self-care plan as you're giving it away to other people. That's one of the things I have every person have their own self-care plan that works for me. Because it's not, will you feel overwhelmed? You will feel overwhelmed in your job. You will need to recommit to yourself and to the goals of your reason for being involved in this type of work. So I thank you for letting me be with you this afternoon. I think I got done right at the 3 o'clock hour with only one. I realized I was watching the clock, but instead of watching the clock, at some point it got to where the tape recording number was the number that I was shooting for. So it got my brain messed up. But thank you very much. If there's any last minute questions or whatever, I'll look at the chat, and I hope this was helpful and that you had at least one takeaway that's useful for you.
Thank you, thank you, thank you, Debbie. That was great. Wow, a ton of information. I will send an email out to everyone in the next hour or so with the survey link and the links from the session. And I want to remind you, if you need to check on the requirements for CEU, you can do it in the reminder email or in your reservation email. And you have to be done with the survey within 48 hours. It won't be open for indeterminately. So you can direct any questions to the Empower Idaho email. If one of my colleagues will put it in the chat, that would be great. The slides and the recording will be available on the website in a few days. And once again, thank you, Debbie. That was a wonderful presentation. And thank all of you for attending and for participating. It really made it a great session. Have a wonderful rest of your day.
Thank you.
Bye, everybody.